Hi, my name is Jamie and I'm a student at Indiana State University in the Nursing 444, and I'm here today to talk to you about sexually transmitted infections. Here's a little outline of our program today. I have a pre and a post test, and the links for those are below. Please take the pre-test and then come back to the presentation, and then after it's over, go ahead and take the post test. There's also a link for a brochure for you to print and hand out as you want. Then we're going to have an introduction, the population at risk, objectives, what are sexually transmitted infections, types, symptoms, treatment, diagnosis, prevention, and what to do when you are diagnosed, and then some facts about STIs. Anyone that is sexually active, especially those having unprotected sex or multiple sexual partners, are the population at risk. It's not just young teenagers or prostitutes or homosexuals. It is all ages. The last several years that has been going through senior living facilities. And so it is not just a young person's disease or illness. Our objectives today are to name 3 ways to prevent sexually transmitted infections, name 2 ways to treat them, name 3 symptoms of sexually transmitted infections. What are sexually transmitted infections, or STIs? A sexually transmitted infection is an infection passed from a person to a person during oral, anal, or vaginal sex. It's common in 1 in 4 people in the United States have an STI, and it's not just young adults or teens. There are 3 types of an STI. You have bacterial, which is chlamydia, gonorrhea, or syphilis, parasitic, which is trichomonas, and viral, herpes, hepatitis, and HIV. Symptoms of all STIs can be discharge that is clear, white, greenish, yellow, that comes from the vagina or the penis, a strong odor from the vagina, vaginal itching and irritation, itching and irritation to the penis area as well, painful intercourse, painful urination, or sores in the vaginal area or the genitals, or if it's oral herpes, it would be in your mouth or on your tongue. Treatment. There are treatments for both bacterial and the parasitic. Bacterial is usually a quick treatment. It's usually just a few doses of antibiotics, and the same with parasite. Viruses are not able to be cured, but they do have antivirals that help fight them off. There is no cure for HIV. Usually, once you have herpes, you will have outbreaks. Sometimes you are dormant and don't have any sores, and at that point, you're not contagious. But once you do have a sore, you are contagious, and you can pass it to one another. A lot of times with herpes, it comes out when your immune system is weakened or there's been a stress in something else in your life. To diagnose, there are blood tests that test for HIV or the late stages of syphilis. Urine samples can test for chlamydia and gonorrhea, and fluid samples like from a pap smear or swabbing the genital sores and sending that off are ways to diagnose sexual transmitted illness or infections. But you have to be seen by a doctor. There's a lot of public health clinics that will see you and help you diagnose for those. You can also go to your primary care doctor. A lot of the universities have health clinics that you can go to. School nurses can point you in the right direction on where to go to help get diagnosed if you think you may have a sexually transmitted infection. There are ways to prevent passing along a sexually transmitted infection. One would be abstinence, stay away from having sex, monogamy, only having one partner, not having multiple partners, using latex condoms or other barrier methods such as vaginal dams, oral dams, limiting the number of partners, not sharing needles, and having frequent tests if you do have multiple partners to make sure that you're not infected with something and passing it along. You can also, some of the creams or gels for birth control can also help kill off some of the bacteria and viruses when having sex. Why are you at risk for an STD or STI? Having unprotected sex, being under the age of 25. More women are susceptible than men, and that's because the sperm or semen go into the vagina and it sits there, so it's able to absorb easier. Using illicit drugs, you increase your risk of infection, bloodborne pathogens. Having more than one partner. Alcohol use. If you're using alcohol, your lack of judgment, or your judgment lacks in making decisions that are beneficial to you. Those that are having sex for money or drugs or trading, or those that already have an STI typically are more susceptible to getting another one because of their lifestyle habits. What to do if you are diagnosed. Take the prescription as prescribed by your doctor. Seek medical attention. Tell your partner or partners. Get retested after 3 months, even if you're negative. Use protection when you're sexually active. It's important to tell your partners that you have one so that they don't pass it on to somebody else, even if you're no longer with that person. Going untreated, syphilis can cause mental illnesses, as well as all of them can cause birth defects and other issues. Some facts about STIs is it can cause infertility if left untreated. You can pass it on to an unborn child during childbirth. It can lead to pelvic inflammatory disease if it's left untreated. It can also lead to ectopic pregnancies, which can cause death in women. Increases your chance of HIV. HPV increases the chance of cervical cancer, so you could end up getting cervical cancer if you have HPV. And there are vaccines available for both women and men now for the HPV. STIs are important to seek medical attention for, or if you suspect anything. It's good for annual exams for both men and women, especially once you become sexually active. As a parent, it's your responsibility to teach your child that it is important for sexual education and annual exams, and also to help protect them against childbirth or STIs, so that they don't have complications later on in life. They're easy to treat and they're easy to prevent if the proper measures are taken. And it's not just for young people, it is for older people, all ages of those that are sexually active and have multiple partners should be checked regularly. Thank you, and here are some references. They also have some good information to go and seek for specific diseases and what you can look out for and the complications from them.